In this fall issue, Dr. Jason Pear from California presented an interesting case.
JP presented to my office at age 7 years and 11 months for an orthodontic evaluation. He had a medical history significant for cranial development issues when he was an infant, with extensive imaging. Consequently, he was delayed in development both physically and dentally, but has since reached milestones appropriately. His initial Panorex revealed erupted, severely malformed first permanent molars and unerupted malformed central incisors. Because of his delayed dental development, the decision was made to begin intervention once those maxillary incisors had erupted. So we returned back to my office a year later. At age 8 years, 10 months, we took a progress Panorex and then referred for extraction of all the first permanent molars, the maxillary primary laterals and cuspids, and mandibular primary cuspids. The extracted first permanent molars, you can see in the photos, were severely malformed and would have had poor long-term prognosis. Due to his slow dental development, phase 1 records were not taken until he was 10 years and 7 months old. As you can see from the extraoral photographs, he has a mildly protrusive upper lip, mildly retrognathic mandible, short lower face height, but otherwise well proportioned. Intraoral photographs reveal class 2 deep bite with over-erupted lateral incisors, and you can appreciate the malformed central incisors. There's not insufficient space for eruption of the permanent cuspids in the lower right quadrant and the upper quadrants, with excess spacing in the incisors.
This is JP's phase 1 panoramic radiograph. On the left side shows JP's phase 1 lateral ceph and its tracing. On the right side, the table listed the cephalometric measurements.
The goal of phase 1 treatment was essentially to consolidate the maxillary incisors, which we did in the course of about 10 months. And after they're consolidated, we retained with the maxillary Hawley retainer and kept him on recall for a couple years. Waited until after his bar mitzvah before we started phase 2. So pre-treatment records were taken at 13 years, 1 month, and phase 2 treatment lasted about 2 years. When we took the phase 2 records, we noted they were still developing second permanent molars and third permanent molars. The second permanent molars had not drifted all the way into contact with the second bicuspids. However, the mandibular left second bicuspid had drifted significantly to the distal, and the mandibular left primary second molar was retained. A root tip was also noted distal of the maxillary left second bicuspid, which prevented further mesial drift of the second permanent molar. It would have been prudent to have these primary teeth and that root tip removed some months earlier. The phase 2 plan was to begin treatment with bonding of 5-to-5 Damon Q brackets, bite turbos on the lingual, the maxillary lateral incisors, and then immediate short class 2 elastic on the left side to help upright that second bicuspid. The second permanent molars were bracketed as they erupted, and any residual spacing was closed. He was debonded after 20 months of active treatment, and then some aesthetic composite restoration took place 1 month later on the upper central incisors. He was retained with daytime Essex retainers and nighttime wraparound Hawley retainers.
For more details about how JP's case was treated, please visit the PCSO Bulletin website and read this 2024 fall issue. Thank you.